Good afternoon, everybody. It is my great pleasure to welcome our colleague Tim Takaro from SFU. Tim has a very long and strong history in occupational and environmental medicine and has recently returned from sabbatical in Nicaragua, and he is going to tell us about that work today, which is very exciting. Welcome, Tim.
Thank you for having me. It's a pleasure to be back at what is no longer SOE, and I'm obviously really outdated here. But I was on sabbatical, and a lot of things went over my head. What I'd like to talk about today is some of the work we're doing in climate change and water and health, and how we're trying to apply some of that work that's BC-based to building resilience in watersheds in Nicaragua. So I think a lot of you know this story already. British Columbia is experiencing increases in extreme weather events, reduced glacial and snowmelt storage. This is my favorite glacier. Does anybody recognize this one? It's in BC. It's in Glacier National Park. This is the Illecillewaet Glacier. This line down here is 1887. The photo is taken in about 2000. So you can see the recedence of this glacier. This is obviously a big factor when it's multiplied across the entire province, and I'll show you in just a minute how it is, because of reduced water for irrigation, for fish, for drinking. In addition to that, of course, our coastal lands are experiencing sea level rise with saltwater intrusion, coastal land instability, and changes in the fauna. This shows how widespread the reduction in glacial surface area is across the province. We're not as bad as Alberta in many ways, including this one. But we still have an overall average of 10.8% loss in glacial surface areas between 1985 and 2005 when this data was published. So big changes here. We can expect changes in regional precipitation as well. And this is based on a projection from climate models comparing the 1980 to 1999 average precipitation to projected 2080 to 2099. And you can see that there's quite a bit of variation, looking at Nicaragua, for example, compared with British Columbia. This is a dramatic increase that we are going to experience compared with the drying of the isthmus of Central America. But the resolution on this is terrible. It's almost no use for planners. Fortunately, with new modeling techniques, we are getting better. The Pacific Climate Impacts Consortium at the University of Victoria is producing models now on a 10 by 10 kilometer basis, and we're beginning to use those in some of our GI illness work, hoping to get the sort of resolution that might be useful for planning purposes. An interesting aspect, I think this is a very new Nature paper, came out last month. We've noticed that the extremes of latitude are warming more. The north is warmed about 4.5 degrees centigrade in the last 100 years compared with the global average of about 1.5 really now. But this data is looking at the climatic change, and the scale here is telling you when the global average, or I'm sorry, the regional average of temperature variation is completely changed when the highest temperature of the previous epoch becomes the lowest temperature, that is a complete change in climate. And that is going to occur in the tropics much sooner than the Arctic because there's less variation year to year, day to day in the tropics. And so that complete change, which from an ecological standpoint is very dramatic, is going to change around the year 2020 for this zone in Nicaragua, for example, all of this red zone. By 2020, that dramatic shift will have taken place. You can see that some of the most dramatic changes, the earliest ones, are actually over the oceans because of the nature of ocean currents. So this is sort of turning our notions of rapid change on their heads, because we've always thought about it in terms of the Arctic being the most rapid change. But in fact, from an ecological standpoint, maybe we're looking at it not the correct way. So it's been known for a long time, since Hippocrates, that disease occurs in a seasonal pattern, particularly infectious disease. And that this is identified by the WHO as being one of the first indicators that infectious disease might be associated with climate change and the emerging infectious diseases, and those changes in infectious disease patterns may be linked to climate change because of this seasonal pattern. Now, there are a lot of studies that have looked at acute GI illness. These are either parasitic or bacterial diseases. And what they have shown is that there is seasonal variability, certainly, that there's a peak for bacterial infectious disease in the early fall, in the warmer summer months, associated very tightly with temperature. But later, for the parasitic diseases that are much more likely to be waterborne. So that is an interesting pattern also. We feel that better understanding of the relationship between water source, and in this case, unit of analysis being, or really I should say unit of governance. I don't want to confuse the epidemiologists in the room. The unit of governance being a watershed, so not a political boundary, but like the health authority, for example, but a biological boundary. That understanding all of that is really key to mitigating possible ecosystem effects of climate change, particularly in terms of the global burden of acute GI illness. About 2 million people per year dying of diarrheal disease still on a global basis. So what is the role of precipitation? There's a lot of anecdotal evidence to suggest that the Walkerton incident was due to an extreme weather event. There is a relationship between acute GI illness in other settings, but it is difficult to quantify exactly what is the extreme that produces this increased risk, and is it really, particularly when you're talking about sporadic GI illness, that illness that is not an outbreak-associated illness, then as you'll see, there is this cyclical pattern. So what exactly is the role of an extreme event in that cyclical annual pattern? There's a nice study that was done by Takaro now more than 10 years ago, which looked at the outbreaks of gastrointestinal illness, now outbreaks as opposed to sporadic disease, and that they noticed that if you looked at called an extreme event, anything above the 90th percentile for that day as being an extreme event in terms of precipitation, that about half of the outbreaks were associated with precipitation events in that extreme, calling above the 90th percentile extreme. And then if you use the 80th percentile, 68%. So I do want to get to Nicaragua again. But first, I think we should talk a little bit about our local backyard situation. So we've been studying acute GI illness using BC CDC data in 8 British Columbia communities, and now most recently in Fraser Health, the entire health authority. And our desires here are to describe the temporal and spatial distribution of acute GI illness, to see if there are linkages between the watershed and the drinking water systems. We already know from previous data in Langley. I think Kay Teschke has presented in this to this group about that data. We know that drinking water systems are a risk factor. Watershed characteristics less understood. We also want to examine any associations between temperature, precipitation, and stream flow. These are the most operative variables in the data that's available to us. And then we want to lay out this framework for looking at this nexus of environmental change, water, and population health, because it's remarkable, but British Columbia has got 100-odd active boil water advisories at any given time. We're usually number 1, but sometimes number 2 in the country for boil water advisories. We have thousands of cases of waterborne illness, and this is not Nicaragua. Drinking water and human health is the acronym here for this. We have 8 communities, 2 in a rain regime, 2 in a snow regime, with either mixed water, 3 in a rain regime and 3 in a snow regime, with either mixed water, meaning the source of water is either surface or groundwater, a groundwater regime, and a surface water regime. So we have these 8 different combinations of hydrogeology to examine. We are looking at GI illness depending on the data, we'll either use 3 or 5 of these diseases. The specificity of waterborne versus foodborne GI illness is much higher for Giardia and Cryptosporidium and Campylobacter than they are for E. coli and for Salmonella. So we, for some of our analyses, have erred on the side of dropping our N by increasing the specificity for waterborne illness. We have not eliminated foodborne illness in that, but we reduced the confounding. The predictors that we looked at include daily precipitation, snow depth, stream flow, temperature, these different water sources, municipal versus private systems. Private systems are higher risk. And then also some treatment, watershed protection variables. What came out of all of this, though, was stream flow, temperature, and precipitation on a monthly basis. And monthly was chosen because the case numbers in any smaller time frame were too small. So we have a time series with 132 months, disaggregated by water source, these hydroclimatic regimes and pathogen type. We use GIS to link to water sources. We display this data for statistical analysis. We choose the models using binomial regression. We then look for dominant cyclical patterns, which I'll show you. Additionally, we created these semi-parametric generalized additive models to look at the associations between temperature, total precipitation, and mean stream flow by month. And these are corrected for seasonal, annual, secular trends. And this is the sort of data that you see. So this is for a rain-dominated community over 11 years of data. And you can see the cyclical temperature variation that you would, of course, expect. It follows by a cyclical precipitation spectrum that you would expect also based on your experience in British Columbia. And not surprisingly, the stream flow follows pretty closely with the precipitation data. What is remarkable, though, is that you also have that same pattern in the GI illness rates. And so that's what we were looking at here, disaggregated by water source. And you can see the red groundwater is the lowest risk throughout the year. This is aggregated, all the years aggregated into one. Mixed water is the highest risk, and it has a peak risk in middle September or so. And this is quite consistent year to year. This shows the difference between bacterial and protozoal disease. I'm sorry, this is snow-dominated, rain-dominated. So the rain-dominated regimes have a later peak than do snow-dominated regimes. The stream flow is, as I'll show you, much more important in the rain-dominated regimes. So here again, you have temperature, precipitation, and stream flow with GI illness cases throughout the year. In a rain-dominated regime, you have the peak that we've previously seen in September, whereas in a snow-dominated regime, that peak occurs earlier in July. It is preceded by this large increase in stream flow. Now in the Fraser Health Authority, we also found a peak in November, which was associated with that period where the ground is totally saturated and there's still a lot of rain and a lot of runoff from agriculture, we believe, is the source of that peak in the Fraser Health Authority. So here's the GAM model results. And the things that are significant in the rain-dominated community are temperature and stream flow. These are relatively small relative risks. IRRs, but they correspond to, and I had to get my little crib sheet here to make sure I got all these numbers right. For a 1 degree increase temperature in mean monthly temperature, the acute GI illness rate increased by 11.5%. For every 10 millimeter increase in total monthly precipitation, the increase in GI illness is only 1%. A 1 meter cube stream flow per second increases the GI illness rate by 15%. These are from the multiple regression models. So the things I want you to take away from this data, basically, and why it's applicable, I think, to our work in Nicaragua, is that context is really important for understanding this relationship between climate, extreme weather, and risk of gastrointestinal illness. So how did I get here? This is a mural on the side of a power plant in northern Nicaragua in the town of San Jose de Bocay. The smiling guy there was a friend of mine back in the 1980s, Benjamin Linder. He was a very young engineer from the University of Washington who got his engineering degree and wanted to go do good in the world. He decided to go to Nicaragua in 1985 84. Couldn't get a job as an engineer immediately, but fortunately he had in his back pocket skills as a clown. He could unicycle, he could juggle, and he joined the Nicaraguan circus and worked in Managua in the circus for about a year before he totally broke into the Ministry of Energy and began building and designing mini hydro plants, first in the town of El Cua, which was in the war zone. At the time, some of you are perhaps old enough to remember, the Nicaraguan Revolution was 5 years old, and it was under threat by U.S.-funded counter-revolutionaries. And Benjamin was right in the thick of it. He helped us. I was a physician working in Jinotega at the end of the paved road. He would help us with our vaccination campaigns by getting on his clown suit and riding down the dirt streets of El Cua on his unicycle to bring the children out for vaccinations. In one of these escapades, he fell, cut his ankle, and in rather typical Benjamin fashion, pulled up his sock and went on. A few days later, his foot began to swell. He got cellulitis. He ended up in our back room getting intravenous antibiotics and was recovered after a couple of weeks, went back up to a new project north of El Cua, where he was measuring stream flow for a new power plant, and was ambushed and murdered by the Contra. 1987 in April. So this was really devastating, of course, for us, but it also was really unified the gringo community in Nicaragua and created an indigenous network of engineers and electricity distribution workers within Nicaragua, which has now a dozen power plants in areas of the country that never would have had power without the mini hydro approach because it's too far to string the grid. So my son is named Ben. And here we are seeing the fruits of Benjamin Linder's work in San Jose de Bocay. So this, I'm sorry, this is in Spanish. I should have done it. But basically what you're seeing here is this is the river flow distribution in the climatic cycle. What it's meant to show here is that Nicaragua lies in this zone between the Tropic of Cancer and the Tropic of Capricorn, which has a dry season and a wet season. And it, so quite different from the more moderate climes to the north and south. And in this extreme situation, you have then periods of very little river flow in the dry season, and then periods of very high flow. And this is difficult, of course, for management of a watershed. This is diarrhea data from Nicaragua from 2001 to 2005, and you see something quite similar, don't you, to what we had. This peak comes around May or June. It is after the long dry season and about 2 weeks, 3 weeks into the heavy rains, having washed out all the accumulated detritus into the water systems, and very regular June-July peaks of infectious disease, gastrointestinal illness. So I've mentioned 2.2 million annual deaths. In Nicaragua, every child has had an outpatient consultation for acute GI illness by age 5. About 1 in 14 are hospitalized, and there's a fairly low death rate now. It was not this way when we were first in Nicaragua in the 80s. The death rate was about 1 in 5 for children under 5. It was incredible, partly due to the war, but mostly to conditions and absence of health care under the old regime. So these are where these little yellow dots are where the new mini hydro plants are that I've mentioned to you. We are going to be talking about this area, San Jose de Bocay and El Bote. That's this one here. These are plants that have gone in since Ben's death. So how do you build resilience in a watershed in a place like this? Well, first, of course, you define resilience. And these are not great definitions. We tend towards the ecological definition, a measure of the persistence of systems and their ability to absorb change and still maintain the same relationships between the populations and or state variables. I think that combined with the social resilience, which you may understand from work in the downtown east side, or where the resilience is the ability for humans to absorb the change. That combination, I think, is what's most useful to think about in a watershed or a mini watershed in northern Nicaragua, where there are many pressures on the land. Agricultural pressures, deforestation, population pressures, grazing pressures, and then sort of the natural ones, differences in soil type, landslide risk, slope, and then one of the most important but often overlooked, who's responsible for the land? Who owns it? Who is the caretaker? So we do have some data on at least the threats to watersheds, but as you'll see, this spatial resolution is not adequate, very similar to the problems we were looking at for the climate models for precipitation. So this just describes green is heavy forest, the light green is lighter forest, savanna. The yellow is agriculture. And what's happening over time, of course, is increasing agricultural land and deforestation. This brown where we're working is a lot of coffee. But this kind of data, while useful on a national level, is not very useful at local planning level. Here are some hazards. This is the red and the orange looking at landslide susceptibility. That's important for watersheds, certainly. But again, the resolution is way too low. Here's precipitation and elevation combined to produce threats from flooding. Again, the area where we're working in does have some of these, but it's essentially useless for planning and protecting local watersheds. Here we're getting a little bit better. This is data from NOAA after Hurricane Mitch in 1998. It's one of the most devastating hurricanes. This area gets hit by hurricanes almost every season. What they did was fly over and do imagery after the hurricane to see what had slid. And they marked out on maps in this region where the slides were, and they're along drainages, as you might expect, but also in steep zones on mountainsides. And this is the beginning of a data set to understand at least this particular hazard in the zone where we were working. What is a watershed? It's defined by altitude. From that altitude, all the water from a particular spring, stream, or river arises. So it can actually be quite small in a highly mountainous zone. Watersheds provide clean water quality. The idea is that a well-maintained watershed would sustain a population, and also sustain a population of flora and fauna, sustain the local ecology to provide these critical ecosystem services. What are some of the threats? Well, I mentioned the landslide and flood, certainly drought, because of the dry season, wet season cycle in Nicaragua. There are periods where you cannot generate power in some of these places, and that people have inadequate water supply for drinking. But there's also these changes in rainfall. There are extended long dry seasons now. There are changes in population and land use which can threaten watersheds, and there are changes in the ownership that can affect watersheds. Most of these threats can be relatively easily measured locally. The people that are working for the organization, it's called the Association of Rural Workers for Development, Benjamin Linder, is very adept at collecting data about those threats. What is difficult, though, is tracking and using that data over time for planning protection of your watershed. So it's extremely challenging to get a city councilor or a mayor to look at a table of rainfall data and make any sense out of it. Impossible, I would say. I've never met a councilor like that. So we've found that GIS is a way of presenting massive amounts of data, overlapping data, multiple threat data, in a form that a policymaker can get their head around. For one thing, these people do know the region. They live there. So the geographic part is easy. And if you can present data in that format and show the analytical capabilities of it, then you can get the attention of these policymakers. So how do you use it? This is the El Bote watershed, the black line here. And these are different land ownership issues. So one of the North American-based organizations that supports the Association of Rural Development Workers, Benjamin Linder, is called Green Empowerment. It's based in Portland. And they are buying land in these watersheds to assist Asociación Trabajadores Rurales in the rural development workers in protecting the watershed by buying property. So certainly who owns the land is really important and something that you would want to have on a map if you're trying to prioritize where do we need to put our resources to protect this watershed versus that one, which one is it more at threat, and where can we have the most bang for our buck. Why would you want to do this? What can you actually do to protect a watershed? This next set of slides I'll go through quickly is measures that were taken in an adjacent watershed to preserve it when it had been overgrazed and deforested. So this is land around Boaco, and you can see that a lot of it has been cleared of wood, largely for fuel, for houses, for burning fuel. And there's a lot of landslide destruction, whole areas of slope that have been overgrazed. You can see the lines of the cattle here. This should be completely forested, dense forest in order to maintain the integrity of the watershed. And you can see sort of what it, the difference. Here's what it used to look like in the middle here in the drainage, and here's the denuded parts, either for agriculture, grazing, or other uses. Here's another shot of the same. So another activity for the rural development workers is to build these berms that can stop the erosion. And so the question then for a policymaker is, this is costly in labor, at least. It is not costly in terms of like living in Vancouver. But it is still a resource that you have to manage. And so how do you prioritize where you're going to put this kind of effort in, and where are you going to put it off because it's not so, the threats are not so bad. Many of these rural communities have the so-called Comité Agua Potable, which is a potable water committee, which is also for people who live in the community. So they're very invested in maintaining the watershed. So there is now a federal law that requires communities to have caps, and they are on the ground trying to catalog the threats within their watershed. So we're providing a tool for that, for them to take data like this. This is from the U.S. National Climate Center data in my hometown of Asheville, North Carolina. It's the weirdest thing. There's like 60,000 people there. And it's temperature from 1982 to 2012 in its zone, showing this increase in 2 degrees C over the time period. But the point is, you can take that data, you can take land use data. Here's a map that was collected by a graduate student of mine who was in the field collecting land use information and gridding it using GPS and GIS to show what parts of the watershed were protected, these in green, and what were degraded in terms of overprotection for agriculture. Here's a closer view of Jordan Bierbacher's map. So putting all these data together in a tool for policymakers can enable some of this monitoring and planning. What you see here is the Cua-Bocay Valley. There's San Jose de Bocay. This is the dam that was, the power plant that you saw was for that dam. What is being depicted here are areas of this reddish, sorry it doesn't show up too well here, but this reddish area are slopes greater than 60 degrees where landslides might be predicted. You combine this with precipitation data, land ownership data, and you can begin to baseline at least what are the vulnerable parts of your watersheds and what are ones that maybe have more natural resilience and would require less effort. So in the current phase of the project, we're doing capacity building in GIS, have help from the Consortium for Advanced Land Use Planning here at UBC, David Flanders and Stephen Shepard. We liaison with the Comité Agua Potable, potable water committees. We are mining data and consolidating it and building these baseline maps, obviously searching for funding, what we always do, and then trying to strengthen these links between the watershed management and quality water to diarrhea prevention. I'll just acknowledge Nicaraguan colleagues, Rebecca Leaf and Bonergue Roca, with the Asociación de Trabajadores de Desarrollo Rurales, Benjamin Linder, Atter Ben Linder. They also from the Center for Environmental, for the Environment and Nature, Alan Bolt and Edgar Castillo. Caitlin Peak with Green Empowerment, Domingo Rivas at the Agricultural University, and Edwin Ojeda at the National Polytechnic Institute of Oaxaca, Mexico, who will be coming here. Edwin is a Nicaraguan master's student. Will be visiting for purposes of studying our vulnerability work in British Columbia. Lindsay Galway, the PhD candidate who produced the data that I showed. We work with Diana Allen in Earth Sciences at SFU, Margot Parks at UNBC, and Stephen Deary, and then the BC CDC, Sunny Mack and Eleni Galenis. And Charmaine Dean helped us with the statistics. So I think that's all I have. Thanks for your attention. I'm happy to answer any questions.
I'll start if nobody else wants to, and then I'll go over to Mika. Why are mixed systems more at risk than surface systems?
Yeah, we've sketched ahead about this, and I can't say I know the answer, but if you think about these large municipal systems like the GVRD, then they have communities connected to 3 different water sources. There are 3 different watersheds. They also have a set of production wells that they can connect to. And so at any given time, you're going to be drinking either groundwater from the production wells, or you're going to be drinking from one of the reservoirs. But sometimes they switch them around. So why would they be switching them? Well, they're probably switching them because there's a problem. That one system has got too much turbidity, or one system is down because the chlorinator broke. This is all supposition. But the only reason to mix is when you have a stressor on the system. Otherwise, it's stable. So that's where we think it is. It's been seen over and over. So I think it's a real finding. I don't know what the real reason is.
Thanks, Tim, very much. Always passionate and educational. Both of these questions are just stem, I guess, from my lack of ignorance in this whole area. But you had several graphs with wide swaths of land and talked about land ownership, and I'm just curious who owns the land.
Yeah.
As you know, a group that you would have to educate or deal with in terms of policy changes. And my second question was, what does natural resilience for a watershed look like? Like, what is that exactly? Yeah.
So the definition that we use on the resilience is that the watershed can bounce back from an extreme event. So what enables that? A fully forested watershed, for one thing, but also one that the trees are the appropriate ones for the soil, that they are on slopes that they can maintain themselves on. Usually this is just the native state, because evolution has a great way of working to maintain watersheds in most cases. So yeah, that, to me, it looks like in Nicaragua, in this zone, it's a heavily forested watershed. And then there are gradations back from that. So if you're going to do the agriculture, do it in a contoured fashion. Have your berms such that you don't lose soil, that sort of thing. So control the way grazing is done and that. This is the map I showed you with the ownership. And so I'll just go over a little bit. The black is a conservation zone owned by the Association of Rural Development Workers. This hatched area is a private area that they are in the process of purchasing. It's somebody's farm, a Calixto farm. The white is all private and not yet available for sale. There are some communities. In other words, none of this is government owned. Yes. 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 There are a few areas in other parts, particularly the coffee growing zones, which are owned by large impresas. But even that on sort of Archer Daniel Midlands scale, way, way smaller.
Wonderful talk. Thank you. So the question that I'm going to ask comes out of a project that I was involved in, looking at a relocation of a community after Hurricane Mitch. And the community was using slow sand filtration and well water was their water source. So, but out of the discussion that we had around just the resilience of communities, really, for their water, we got stuck in trying to figure out what is the better option in a country like Nicaragua for individual control of clean water or community control of clean water. And I'd like your thoughts on that.
Well, that's a really contextual question. So one of the beauties of Nicaragua, and particularly the post-Sandinista period, is the power and strength in these communities. So the potable water committees are very proud farming people, and they are going to defend their watershed. And they will do it as a community, and they recognize that they are much stronger as a community. There is the added aspect that probably individually they couldn't afford to clean their water at the tap. I think that's what you were getting at, right? Yeah. So, so the options, the sand filtration is a good option. The other one that is popular is these ceramic filters. They're very effective, but they're, despite the fact that they're $75, they're out of reach for an individual in most cases. So that's why the beauty of the Sandinista Revolution, if you will, in which the power of the community was enhanced. I think for Nicaragua, or at least this zone, the community approach is much better. That may not be the case in other areas.
We have an online question here. It says, I presume that establishing the link between watershed resilience improvement projects and decreases in diarrhea is related to funding. Where does funding come from for further projects?
Well, it is very ad hoc. Green Empowerment seeks funding. It's a NGO with deep roots in the United States. They have projects throughout the world, about half dozen of them. They are all very indigenous in the sense that the leadership on the ground is, in the case of this zone in Nicaragua, all Nicaraguans. So they, a sort of example of this is that they build a power plant, the first one in El Cua. Associated with the power plant is a machine shop. So that, yes, they did bring the first turbine from Norway, but the second turbine was built in the machine shop in El Cua, as was the third, fifth, 10th, 12th. So the funding, the Scandinavian government has been very, very supportive. Green Empowerment raises funds in the sort of standard NGO fashion from people who care. But it is not enough, very ad hoc. We've tried for IDRC funding. I think everyone knows where IDRC is going. We didn't have an industry relationship going. Who cares anymore? So the funding is really difficult. We've got a grant into Grand Challenges Canada. We're hoping that one will come through. But it's not a Gates Foundation gizmo, and it's not a disaster like the current Filipino typhoon. So it falls in between the cracks, I would say.
Follow-up question to that. I've been surprised within the realm of my parents' friends, the number of people who seem to be retiring to Nicaragua. So I can only assume that this is a trend of some sort. I'm wondering if you can comment on that and whether or not it has any implications for this kind of work.
Yeah, it's a really good question. I don't know. It's happened that a guy from the Washington Department of Ecology landed in Matagalpa in exactly that setting, and is now helping us with data from his work in the Department of Ecology, and obviously expertise as well. So there is a little of that, and that's sort of the positive side. I think the control of development is the big question mark. There are plenty of areas of the country, the really nice beachfront areas where all these people would love to be. That is not going well. People sell the land, they don't even own it. There's false titles. And development is rampant. Yeah, sort of the story is yet to be told, I think.
Well, if there's no further questions, we'll let Tim go. Thank you very much.
Thank you.